I talked to somebody today about their Medicare plan and their choice moving into 2024, and I could tell by the look in his eyes and the genuine concern in his voice that he was definitely afraid of changing, but he knew that there is enough pain in his current situation as far as the monthly premium he was paying to really know that it was time to make a change, time to do something, time to really review his plan. And my hope in this video is that I can kind of walk you through things to think about so that you don't have to be in that much pain to make a change and to review your benefits and to review the cost sharing and potential exposures that you have in your plan. And also for those of you who are really concerned and just don't want to make a mistake when it comes to your health insurance and your medical plans for the next year and for your open enrollment. So this gentleman, he was on a plan that was very expensive. Cost him about $250 a month. But the benefit of that plan is that most services were no copay, and hospitalization, ambulance, diagnostic radiology, all those things were really low in cost sharing. But him and his wife, that's $500 extra a month in addition to the Part B premium. You're looking at $800, $900 a month total in premiums monthly. And that can be quite a strain, especially with inflation and the cost of food and groceries being so high. So what I helped kind of talk him through was, what are the things that could potentially hurt him if he moved to a less expensive plan. He's looking at the zero cost plans, the zero premium, no additional costs Medicare Advantage plans. And he, was looking, and we walked through, the most expensive items were the ones that I said: the hospitalization, diagnostic radiology, ambulance. All those things are going to be much higher if you're not paying a $250 per month premium, right? So when looking at those things, he still was kind of concerned, like, where, how do I feel about this? Can we, play the mental gymnastics and remember to save all this money so that we don't have to worry about it? Is saving the money and thinking about having this large copay, is that pain worse than the pain of bleeding $250 per person every month to pay for the medical insurance? Is that worth it? Are we not bleeding that money, but are we really shuttling that money so that if anything catastrophic happens, we don't have to worry about it, right? That's the pretty much give and take of any kind of insurance premium, right? You get really good car insurance, you get really good homeowners insurance, really good meaning very expensive. Typically your assumption is that you won't have to pay a lot when something happens, right? When you get into an accident, when something happens medically, that your health insurance will pay for most of it, versus if you picked up the zero, right? And really, you could tell he just didn't want to make a mistake. That's most people's fear, is not that they are making a bad decision, it is that they're making a mistake. Because a lot of people would rather have, because this is a prime example of like letting the universe decide for you, especially with Medicare Advantage, because every year the plan does change. Something within the plan changes. And if you let the universe decide, you could be stuck on a plan that is not the right one for you, and you did nothing, and you can blame nobody but yourself. It's not the universe, because you have this whole 7.5 week period to make some kind of adjustment if you need to. And a lot of people, they do not take this time to do that. It could be that they're scared of Medicare agents like me, or they simply don't know about it, right? They don't know that they have this option. They think, they picked one when they first retired, and that's the one that they're going to stay with and they're stuck with for the rest of their life. That is far, far from the truth. In fact, many plans get what's called mapped into other plans for the heck of it. So if you're on a plan from one insurance company, it could move to the same insurance company, different plan, if they're phasing out one of the plan that you're on, and you're all of a sudden on a new plan with a new, entirely new plan ID and everything. So it is definitely something that you cannot leave up to chance. Now back to the person who I was talking about and what I think might be a few options for them based on again, this is going to be based on specifically this person's circumstance. So because all I do is health insurance, I was able to find a kind of gap stop program for him and his wife. What that basically does is, remember I said the hospitalization, the ambulance are all going to be really high, comparatively to what he was getting on the $250 per month plan. Well, we could take about $80 per month per person and completely cover the hospital cost, completely cover the ambulance cost, and completely cover the outpatient surgical costs of the plan by purchasing another health insurance policy that only covered those specific incidents. So this person would still have to pay for the expensive potential MRIs, would still have to pay for the little bit more expensive specialist visits, and a little more expensive outpatient occupational therapy like physical therapy. It's like between $30 versus it would have been currently on his plan, would have been $0. So if he does have any of those things will rack up. But with that same $80, he'd be able to buy a cancer policy that would cover his maximum out of pocket, which would be very, very beneficial if they ever get cancer. And that's all included in that $80 per month amount. And the old plan at $250 didn't cover for things like that cancer. It also didn't completely wipe out the ambulance charge or the hospitalization. Now, granted, it is very niche. Not many people have access to such a product, and not many people have a Medicare Advantage plan that fits so perfectly with this type of a supplemental policy. Now you might say, well, yeah, of course that's gonna be good. You transfer $250 of risk and you exchange it for $80 risk. What's the trade-off? Well, the major trade-off is it's not automatic. So for that $170 difference per month per person, my client will now have to utilize a separate policy when something bad happens. Now, I don't know about you, but I think that's, for someone who is shopping and genuinely uncomfortable with their current predicament, I think that is a viable choice, especially with the risk reward being close to $3,000 a year in medical insurance savings. Now, with that said, that product is guarantee issue in my state till age 70. If you are over the age of 70, you will have to get underwritten, and typically the underwriting for that product means you couldn't have had cancer in 5 years, you couldn't have gone to the hospital, you can't have COPD, you can't have any kind of organ failure. So it is a bit more difficult. You do have to be somewhat healthy, but again, that's the trade-off, right? That's the trade-off that you're going to have to do when you are looking for coverage, and you can kind of bargain the fact that you are healthy versus Medicare Advantage. There's no underwriting at all, right? You could be utilizing millions of dollars of health care, and the Medicare Advantage company has no choice but to allow you onto their plan. Now, granted, yes, they can limit the amount of services you can utilize up to a certain extent, but for the most part, they'll be paying for more expensive services if you are coming in using, that much health care. So I think for those of you folks who are really concerned about your medical, and if you're still here, you probably want a framework for making decisions. And I've talked about it a few times before, but what I really believe when it comes to Medicare Advantage plans, when you're looking at it from a pure financial standpoint, not about the insurance company, whether or not they're going to pay claims, whether or not their customer service is fabulous or sucks, whether or not they own the hospital system, which is an entirely different conversation. When you're looking at the financials, there are very, very few places where Medicare Advantage plans differ. Okay, the one thing that you're never going to find a difference in is the Part B medications. So anytime you get Part B medications, it's usually always 20%. That's going to be one of the highest cost items. Just know that if you are using Part B medications, you'll probably hit the maximum out of pocket. That's things like chemotherapy, anything that you get through an infusion center, that's really expensive. Shots like allergy shots, shots for like Prolia or things you get in the doctor's office, depending on how they bill it. It could be an outpatient service, which is usually on the higher end, like $250 to $300, or it could just be a specialist visit, lower end, $25 to, let's call it $50 per. So if you get those every week, every month, every 6 months, factor that in. And typically it's going to be whatever closeness it was to the last time. The next large item, or probably the largest item, is inpatient hospitalization. If you've ever been to a hospital, you know that typically if you are admitted, you're going to be there for 3, 4, 5, let's call it a week. And most Medicare Advantage plans have a copay from day 1 through 4 or 7. So take those days, add it all up, and that's what your hospitalization copay is probably going to be. If you are hospitalized on a PPO plan outside of the network, your maximum out of pocket for out of network is probably what you're going to be charged. That's unfortunately how it's going to work out. So that's kind of where you would look as far as what the costs are going to be for hospitalization. Just add it up, and that's the price. The next biggest thing is ambulance. So ambulance doesn't have that much variance, but I've seen from $220 up to $350. So that $130 might be a big amount for you if you're really, really skimming down and looking at, especially if you have nobody else to take you to the hospital. If you are living with a spouse, with kids, with family who can drive you to the hospital if something happens, then maybe not that big of a concern. But if you are alone and the only way to get to the hospital, if you can't physically drive there, is to call the ambulance, really consider the ambulance copay. Okay, so that's another one. ER copay, not so much. Usually it varies between $90 to $120. $30 variance, not so bad. The next one is outpatient surgery. So outpatient surgery is for things like knee surgery, a lot more commonly done nowadays. So make sure that is of reason. I've seen plans as low as $15 for surgery and as high as like $450 for that surgery. So take a look at those things, because those are the high cost, really high notional value items. The other thing to consider if you do see a lot of specialists is the specialist copay, but now we're getting really into the nitty gritty. And for like wide sweeping, it's for me hospitalization total cost for the 90-day stay, the outpatient surgery, and ambulance if you live alone. Part B therapy, that's going to be 20%. You're not going to get away from that. So that's how I would filter financially. Now, on top of this, before you go into this, you need to make sure that the plan covers all your doctors and drugs, because if the plan doesn't cover all your doctors and drugs, then you would be paying 100% of the cost, versus like with the Medicare plan and the numbers we're just talking about, those won't even matter because your doctor won't even bill the plan. So make sure all those things work, and yeah, that's kind of how I think about it. I do have 2 sheets that I use, one objective data find, and then one more of like a question, kind of a guided consultation data format and workflow that I use. So if you wanted to see those, then I can go and make a video on how I make those. But for the most part, if you are my client or if you want to be a client, you just need to reach out to me on this YouTube channel. I have my contact information down below as well. Remember, if you live in the states that I represent, I might be able to help you. I don't really know if I can. It really has lots of things I have lots of things to consider whenever I'm sitting down or talking to someone on the phone. But really, these videos on this channel anyway are merely meant to help people who I can't otherwise help one-on-one. So I hope you guys watch this and understand, and if you didn't, you needed me to clarify things, or you don't understand my thought process, please let me know so that I can hopefully make a more comprehensible video. I hope the road wasn't too loud. All right, you guys have a great rest of the day. Do good things, and I'll see you in the next video.